It is one case where I met with an accident. But there can be something where you deliberately do it. Unknowingly, deliberately, planned way you do that. You bring your blood pressure so low, you die. You never know, but the truth is, it came so much low. How much low? Low blood pressure, nobody can die. But suddenly low blood pressure, try to understand the difference. Right? Even my wife, where is she sitting? Are you there? Yeah. If you check her blood pressure, very low, but she's alive. Right? But if, let's say your blood pressure is 140 by 90, and suddenly it comes 90 by, say, 60, the difference of blood pressure, that will kill you. Right? So we have to understand this. How it happens in the world of medicine when the medicine meets the blood. I need the PPT now. Okay. I am taking a case study. Two person. I need two volunteers. Okay? One, aap aa jaiye. One, aap bhi aa jaiye. Thank you. I'll call you next time. I am talking of dying and 2% are ready. Some more are ready. Right? Your name, sir? Dr. Sunil. Yeah. Dr. Munde. So, let's say both of them, Sunil and Munde, right? Both of them are on blood pressure medication. Giving one case study, right? Now, the blood pressure medication is, say, 10 mg of Lisinopril, right? So, that will reduce the blood pressure by 10 by 10. Instead of 40 by 90, 140 by 90, it will become 130 by 80, something like that, right? Dr. Sunil and Dr. Munde. Both are taking the medicine, both are having same health condition, both are having same heart condition. One day, which one should I kill first? You or you? Maybe you. You look smarter than him. No, you. From this side, you look smarter, right? One day, suddenly, Dr. Munde's news comes to us. He is no more. Dead. Suddenly, what happened? He died of heart attack. So the responsibility is on heart attack. Now, as a detective, let's try to see what happens. You need not to be a doctor, you need to be a detective. You understand the difference? The only similarity is both start with D. Rest are different. So, I try to investigate what happens. I don't believe that he died of heart attack, right? So the investigation starts like this. Both are having similar heart condition. He is still alive, he is dead, right? And both were on the same medication, same age, same weight and height. Now, here you try to understand what happens when the medicine goes in the mouth, right? We just pop up the medicine, we do not know what it is going to do. Let's try to understand. When the medicine you eat, consume, for example, in this medicine, Lisinopril, the blood pressure medicine, 2 mg of blood pressure medicine, in this case, can reduce the blood pressure by 10 by 10. Clear? But here, how much medicine he is consuming? 10. Why? Because 8 mg medicine will be lost in the stomach. Getting the point? Ultimately, in the blood, how much medicine is going? 2 mg. So, as an expert doctor, they know that if I put inside his blood 2 mg of this medicine, his blood pressure will be down. But he also knows that if he eat the medicine, 8 mg will be, 1/5 will be gone. 80% medicine will be eaten up by the stomach. This means if I really want him to, his blood should have 2 mg of blood, of medicine, how much mg of medicine he must eat? Calculation is clear? If the doctor decides to put the medicine through blood vessels, then how much medicine is required? 2 mg. Because then it is bypassing the stomach. You understand this first point? Right? So this means, although you are taking 10 mg, but your blood, how much circulating? It is 2 mg circulating. The first step. For both of them, Munde and Sunil, Dr. Sunil, 2 mg is circulating the blood on the first day of when he consumed the medicine. First day. Right? What will happen the second day? Second day, what he is doing? One more medicine. The first day medicine, let's see what happened inside the body. Right? This is called first pass of lisinopril. First pass. First pass, first barrier is the liver. After that it goes to the blood. First pass. So for first pass, the medicine is lost by 80%. In this case, in other medicine it will be different. Let's see. Now, for example, for insulin it is 3% only. 3%. This means if you want to consume 10 units of insulin, but through mouth, you have to take about 350 units of insulin by drinking. When you drink 350 units of insulin, ultimately in your blood, how much will go? 10. Getting the point? And that will be too expensive. So insulin is given by the injection, right? Through the blood vessel. Right? So that happens to all the medicine, but for some medicine it is 10%, 20%, insulin 3% bioavailability. It varies. That is the first step. It is the first step the medicine reaches the blood. Now in the blood what it is doing? That is very, very interesting and important. In this case, the first case, the medicine which both the patients are taking, the medicine will stay for 12 hours. It is called half-life of elimination. Within 12 hours, the medicine will become 50%. So 2 mg will become how much? 1 mg. So after 12 hours, if I try to check how much medicine is still in his blood, how much I will find? 50%. But if I want to check how much medicine is there after 24 hours, how much it will be? Half and half of that. 0.5. This means tomorrow when Dr. Sunil is about to take the medicine, again how much mg medicine? 10 mg medicine. At that time in his blood, how much is circulating already? 0.5 is already there, right? 0.5 is already there. This means day 2, the amount of medicine in his circulation is not 2 mg, it is 2.5 mg, more than the first day. Is that clear? One day, the 0.5 mg is the remainder of the previous days. Now third day. Third day in the morning at the same time, try to take 10 mg medicine. How much medicine is already there in the blood? More than 0.5 mg? It will be 0.0625. So the intention of the doctor was, let in his blood the amount of medicine circulate be 2 mg, but by third day, the amount of medicine which is circulating in his blood is how much? It is the third day only. Try to understand, only third day. But for how long the doctor want him to continue the medicine? Whole life. Third day. Whole life. Right? So this is one thing. This means the intention and the outcome is not same on the third day itself. Right? Now, the story, both are alive at this time. Right? Till this time, thank you. Both of them are alive. Then something happened to him. Who died? He died? You died or you died? Sorry. Right? One day, something happened to him. He got a friend like me. I invited, Munde. Dr. Munde, I invite you to my house, and my friend has brought, where is that fruit? Yeah. These are very expensive fruits from US. It's called grapefruit, right? In Hindi, chakotra. Have you heard of chakotra? Right? So I'm inviting him for this chakotra juice. Right? It is very famous and very tasty, right? And it is about 250 rupees one like this, right? So Dr. Munde came. I made a juice for him, very tasty, vitamin C, full of immunity, energy. The moment he took it, the next moment, can you guess what happened? He died. He died of heart attack. He died actually, right? Now, the death is because of heart attack. That's what everything will show. But what happened just before? You are a detective, not a doctor, right? So detective will focus on what happened just before that. This, right? So now, next day, I have one more that is there in the green room. Next day, I thought one more friend is left. Now, I invite him also. ignoring, so what happened? It was an accident, I thought. Next day, I gave a juice. What will happen to him? Same fate, he died. So both are dead, right? Now comes the problem. What is the problem? It cannot be so much coincidence, right? So there has to be something more than that. So the next slide is the most important, will give the right picture, right? Reveal the truth. So till now we know what happened after 3, 4 days, 10 days, 20 days, let's say the amount of medicine which is flowing in their blood is more than 2 mg, about 3 mg, right? By third day it was how much? But maybe after 10 days, after 2 months, after 3 months, after 4 months, 3 mg, right? Instead of 2 mg, 3 mg is flowing. On that day, after 3 months, 4 months, one day, they took this drink, right? And what is that about? It is called grapefruit. Important is, the grapefruit, when you drink, it increases the medicine flow by 5 times. Getting the point? The day you drink that juice, the medicine, the 10 mg you have taken, all the 10 mg or 8 mg will go in the blood instead of just 2 mg, right? This interacts with the liver and the result is 5 times increase in the flow of medicine to the blood. Getting the point? This means it is equivalent to, on that day, both of them or he took 5 medicine instead of 1. That will lead to high blood pressure or low blood pressure. Very, very low blood pressure. Instantly low blood pressure, right? So that is what is called drug and food interaction. But the problem is, this interaction are never told to anybody. It is just it is his bad luck that he came across people like me, right? And he had to go for a drink. It is good luck that he did not came across people like us, right? So it is about, when you are on medication, if you are alive, you are lucky. You are lucky. And don't forget, 30% medicine is fake. Fake. By producing the fake medicine, they are saving your life. Try to understand. Right? Otherwise, you would have died much earlier. Right? You are taking medicine, imagining it is blood pressure medicine, but it is not a medicine, just a placebo, and you are saved when you drink this. Okay, now, so, but here the problem is that in India we don't find this fruit, so we need not to worry. But I can tell you, this fruit, it is called grapefruit, and the ingredient which causes this, that ingredients are present in mosmi, in oranges, in pineapple, all of them it is there already, right? So all the citrus fruit contains the same ingredient which causes the 5-time increase of medicine flow inside the blood, the first pass, right, as it happened in this case. 5 times may not be for all medicine, but I'm talking of this medicine, but it will interfere in this way for every medicine in some way. But that some way is going to be very, very drastic, this side or that side. This side means increasing very much, that side means decreasing very much. Getting the point, right? And that is not just limited to grapefruit. But why I'm showing grapefruit? Because a lot of research were done on this. Why? Because the research is done outside India only, these kind of research, and there these fruits are found. But the important thing is this, right? For example, with very lot of sadness, I have to say that some of my patients, they take a middle path when they watch my video. Okay, I will take the medicine which doctor had told, and I will take the diet which Dr. Bishwarup has told, right? But this and this, what is going to happen? What? Death, right? So, 2 people in my career of 10 years died like this, two of them. I don't want any third person. So we are here to discuss, right? Thank you. So now, एक बार फिर आपको जिंदा कर देते हैं, right? You are alive, and thanks for coming. This for both of you. Thank you. Thank you.
Thank you.
Thanks for the courage. Every citrus fruit. But how, कैसे? I'll talk. Right? Thank you.